So let me have your name and who you are.
Leah Castagna Munoz. I'm with Air Methods, represented locally by Native Air.
So tell me, what exactly is Native Air? What's their mission?
So Native Air's mission is really, to save lives. It's really to support the community, help those those critical patients that need timely transfers from one hospital to the other, or you're in need of transport from a scene, from a motor vehicle accident, from the EMS ends, ground EMS ends, to a higher level of care. We're there for those that need immediate transport to the higher level of care hospitals.
When did Native Air come to be?
Native Air was born many years ago. It was purchased by Air Methods about 10 years ago and became part of Air Methods, which is the largest air medical company in the United States.
Explain to me exactly how it comes to be. Let's say there's a car wreck or what have you. How does Native Air get in there and save a life?
So when there is a major emergency on scene and there is a feel for a critical call, a critical patient that needs to be transported, correct, we're put immediately on standby. Our dispatchers, they assume that there's a need for a medical transport, or they're told that there's a need for a medical transport from the ground ambulance or provider, or from a fire department providers. They put us on standby. When they're on standby, our team is ready to go. They become ready to go. They can get ready very, very quickly. They get in the helicopter and just wait to see if they're going to be launched or not. Now, when it's a very, very critical need, they're launched and they head over to the scene. Then our fire department or EMS ground, they're highly trained to create a landing zone that's safe. They land the helicopter safely. And, when the helicopter gets there, it's small, like a baby emergency room or a baby ICU that lands on scene. Our clinicians transport blood. They're very highly trained, and they provide certain care that wouldn't be possible to be provided in the back of an ambulance. And then they transport the patient from scene to a level 1 trauma center if they're level 1 trauma patients. In this case, El Paso is the closest level 1 trauma care. That's where a helicopter transports the patient to. So from the accident to the hospital, it's just a matter of few minutes of transport. What the difference is, air transport versus, ground transport is really timing. It's really a matter of life or death at that point. They're able to grab the patient, take care of them, transport them to the hospital in literally just a few minutes. And that's the difference.
Sounds like you are filling a very specific role when it comes to saving life, especially knowing that oftentimes in a severe case, minutes count, seconds count.
Right.
And the fact that you can swoop in, get a patient, and get them out so quickly is, there's no way of telling how many lives you've literally saved. So this is wonderful. I love this. If someone wants to learn more about Native Air, how do they go about doing it?
So they can go to our website, Air Methods. The parent company has a wonderful website where you can find a lot of information on transport, post-transport care, and everything else. So www.airmethods.com. And you can learn all about Air Methods and what we do. You can even pull up a map, see where we're located, see what insurances we're in network with. There's a lot of great information there. And another thing that they might find interesting is we're definitely always looking for great candidates, great talent. We're always looking for great clinicians, great pilots to work for us. So I would definitely encourage anyone in the field, to go in and see what we have open. There is a career section under the Air Methods website. They can take a look what the requirements are to work for Air Methods. We definitely will welcome anyone that's interested in pursuing a career with Air Methods.
So anyone with some medical experience or what have you, this would be absolutely perfect.
So specifically what we're looking for, when it comes to hiring, we're looking for pilots, we're looking for nurses, we're looking for paramedics and mechanics. So we have openings throughout this area, throughout southern New Mexico, eastern New Mexico, really all over the country. I know that there is a lot of military personnel in this area, especially, at Holloman, and they're ready to transition to civilian life. Please look at those opportunities because it really is a great company to work for.
All right, Leah, before we let you go, is there anything else you want to say?
I appreciate your time. Thank you so much for giving me the opportunity to be with you today.
You're welcome.
Definitely when you see a helicopter in the air, please know that clinicians that are saving someone's life, say a prayer, just be understanding that's what's going on in the air and just send your praises over because they're doing a great job up there.
That is, I can't add anything to that. That's perfect. I love it. All right, Leah, thank you so much again for joining us, and hopefully someone learned something today about what you're doing, and perhaps maybe we can find some people to add to your staff because it sounds like you're needing that as well.
Absolutely. Thank you so much. And again, go to www.airmethods.com for more information.